Top Med Talk.
Welcome to Top Med Talk. I'm Kate Leslie and I'm here at Euroanaesthesia 2025, the annual meeting of the European Society of Anaesthesiology and Intensive Care here in Lisbon in Portugal. We're having a wonderful meeting so far. We've had wonderful hospitality from ESAIC, the European Society of Anaesthesiology and Intensive Care. And I'm very fortunate to have two wonderful guests here from the leadership group of ESAIC. Michel, would you like to introduce yourself?
Yes, hi Kate. This is my second time that we speak to each other at Top Med Talks. My name is Michel Struys. I'm the acting chair of the scientific committee of ESAIC.
Excellent. And Fabio?
I've been recently appointed as the next chair of the scientific committee, so I will follow Michel in this role. And I'm still trying to get into the system to learn many things, despite I've been serving ESAIC, formerly ESA, for more than 20 years. But this is really a very important position in the society. The scientific program is so important, so the chair has a big responsibility, which I completely feel, and I will try to learn as much as I can from Michel.
Excellent. So, Michel, when did you start being in the role of the chair of the scientific committee?
I was elected 3.5 years ago as the chair-elect, and I started last year becoming the chair, and it's a mandate for 3 years. So I had the pleasure to organize ESAIC, the scientific program, last year, this year in Lisbon, and next year in Rotterdam.
And last year you implemented some really exciting innovations in the scientific program and in the way the whole conference was run, actually. That was in Munich.
Yeah, we continued that this year. It's still a lot of fun. We have 3 topics: value-based healthcare, connectivity is still there. And when we talk about connectivity, of course, you also talk about artificial intelligence. And sustainability is also still one of our very important topics to cover. So this year, first time, it's value-based healthcare. Because as ESAIC, we want to spread our portfolio, not only being anesthesiologist in the OR or intensivist in the intensive care, but being the doctors of perioperative medicine, starting, in fact, from the front door of the hospital when a patient enters at the emergency service or just at the polyclinic, needing surgery, getting that surgery, hopefully not going to the intensive care, but that might happen. And then, of course, at the wards, where we also feel that we have an important role to play as anesthesiologists.
What is the status of perioperative medicine in Europe?
Well, it's not a uniform approach to perioperative medicine. There are differences, sometimes even large differences between countries. There are places where there is a strong awareness of the importance of taking care of the patient through the entire perioperative path, and there are places where this is still weak. So as Michel was saying, ESAIC is very much committed to make this process, perioperative process, strong, because this is for sure the way the anesthesiologist and intensivist can guarantee a good outcome to surgical patients who nowadays are elderly and fragile. So they really need a perioperative approach, and ESAIC is doing a great job in this sense.
So what are the pillars of ESAIC's program for perioperative medicine?
Well, ESAIC is ESAIC since few years. Historically, it was ESA. Incorporating intensive care in the anesthesiology was the strong signal from ESAIC that we wanted to go through the entire perioperative process. So the pillars are, and you can see this in the scientific program, delivering also topics related not only strictly to the anesthesia time, but to the entire perioperative course. So this requires expert speakers or tutors in the simulation, in the workshop, etc., showing how to take care of the patient also after the operatory room, before the operatory room, even in a critical setting like the ICU, as Michel was saying. So It's a complex job that ESAIC is trying to deliver, but it's really needed if we look at the surgical population nowadays.
And is ESAIC doing anything in the trainee group or in examination in relation to, or training in relation to perioperative medicine?
Yes, absolutely, we are. We have a very active training committee and trainee committee where the trainees actively are not only involved in the program of conferences like Euroanaesthesia, but also have a position at the board level. So we really believe that the future should also be incorporated into the leadership of our society. And we listen to our trainees very carefully what they want, and because they are the future. We also involve them in education. They have their own spot at the center of the exhibition hall, also to talk to each other, to have their own educational platform. And they are also integrated into the education committee, where Joanna Berger, our colleague, is chairing that committee.
And is there any intention in Europe to develop a diploma or a fellowship in perioperative medicine that might be, an additional qualification that anesthesiologists might take?
Oh, you have the European exams, of course, organized by ESAIC, which are now a global product, and then a lot of countries are even using the ESAIC or the EDAIC Part 1 and 2 exams as part of their trainee registration. It's becoming more and more the official exam in anesthesiology, not only in Europe, but also in other countries outside Europe.
We interviewed the chair of that program last year on TopNet Talk, so you can go back to our archive and have a listen for more information about that. So Fabio, what are you hoping to learn from Michel as you move forward towards being the chair of the scientific committee?
Oh, a lot. Because, of course, Michel has a long experience, not only as chair of the scientific committee, but over the last years he has been the chair and he will be also next year. So the most important aspects that I need to learn from Michel regard the need for communication within the society, because the scientific committee overlooks a large activity run by other committees and forums. But this requires strong communication, strong leadership, because sometimes decisions are needed, especially when people do not agree.
Yes.
And such decisions are so important because we are speaking of the scientific activities and programs of the largest anesthesia and intensive care society in Europe. So every country, every hospital, every place where there is an anesthesiologist, ESAIC is committed to deliver an homogeneous approach to the patient. So this is what I really need to learn from Michel, how to deliver this role at the best in a way that the product that we get, the scientific program and all the education that is strongly linked to that, is absolutely what we need for our patients.
One of the great things about the Euroanesthesia meeting is that if you look around, you'll see people from every European country represented in the scientific program. And also the program is organized in streams. So each of those streams has got a fantastic clinician, researcher, communicator at their head. How do you go about appointing those people, Michel?
Luckily, Fabio and I, we don't have to do this alone. The scientific committee is now around 80 people. We have 6 forums dedicated to therapies, patients, devices, and so et cetera, et cetera. And we have experts in these forums dedicated to that specific topic. And they are selected by, you can apply. There are positions and they are published on our website. And then you can apply to one of these positions. And if you like you're elected. No, it's not that. Of course, you need to have show an expertise in this.
So it's great to hear, because in the olden days, these positions were filled by a tap on the shoulder.
Yes.
A junior faculty member or a friend or whatever, and it tended to be that these people lacked diversity. And now with a system where you can apply freely, you must be getting amazed by the talent that's out there in the European community.
Oh yeah, and that's fun. That's fun to do because you got a lot of applications, and people who are listening to this podcast and who are anesthesiologists interested in joining us at the scientific committee, believing that they have a special talent and expertise, they should apply. And we hope that for every position we have, that we get a lot of applications. So we have a selection and we can incorporate diversity and inclusivity in our scientific committee. Because as you know, Europe is not one country, and we have even more member states than only the European countries. And yeah, we want to have as diverse and inclusive scientific committee. Yeah. So people should apply.
And for those listeners out there who are interested, you don't need to live in Europe to become a member of ESAIC, the European Society of Anesthesiology and Intensive Care.
That's correct.
For a small fee, you can go to the website and join up, and then you'll have a whole range of educational material and support there. And from an interesting European perspective as well.
Yes, and a very diverse one.
Absolutely, yes. This is one of the strengths of ESAIC, inclusivity. So you can be an anesthesiologist and an intensivist in any place.
Even Australia.
On the other side of the globe. And you can, yes, absolutely, be a member, actively participate. And also the streaming allows this, no? Participate. And I think that this is one of the reasons why, as Michel was saying, many people apply for the vacancies that ESAIC announces. People see the results of the hard work the society has been doing over the last years in particular, and are fascinated by this and want to participate. That's why, as you said, we have excellent speakers, tutors, people participating, because they are attracted by the results. They see what can be the positive consequence of their commitment. So, yeah. And that's one of the reasons why I myself applied for this position.
So next year's Congress is in Rotterdam.
Yes.
Which must be quite close to Groningen, where you are the chair.
It's 200 kilometers, yeah. That's quite
in
close.
Australia, we call that quite
Yeah.
close. Yes. What is there to see and do in Rotterdam and the surrounding area?
Yeah, Rotterdam is a very vibrant city. It's quite a large city, and the Congress Center is also a quite modern Congress Center. It's Ahoy. And there are also rock concerts going on in Ahoy. It's a very large place with very good accommodation. And Rotterdam is a city with also university, so a lot of youth. But it's a large city with also harbor and nice sailing facilities and a lot of pubs and bars and nightlife. So yeah, there is a lot to see also in Rotterdam. And it's very close to the international airport of Schiphol. You can take, you land in Schiphol, you take a train, and half an hour later, you are in the center of Rotterdam.
I love the name of that airport. When I used to live in Scotland, I used to go through there to Val d'Isère, and I always thought it sounded like ski pole.
No, it's Schiphol.
And I'm sure that there'll be just as many Australians in Rotterdam as there are here in Lisbon. And can you give us a sneak preview about where the Congress is going to be in 2027?
That's a little bit too early.
We cannot disclose, but we have it in mind.
Okay. Well, you heard it here on Top Med Talk that we're not allowed to know where the 2027 Euroanaesthesia meeting is. Well, it's been fantastic to talk with you both. Congratulations on a magnificent Congress. We hope that you have a wonderful next date or two and a well-deserved break at the end.
Thank you for having us.
Thank you. It was really a pleasure. Thank you.
So you can find our podcast on our app and also on our website. And you can also follow us on social media. We're on Facebook, X, Blue Sky, and YouTube. And if you go to YouTube, please give us a big thumbs up, because every thumbs up helps. And we'd like to thank ESAIC for their fantastic generosity at having us at the meeting, and also our sponsors, BD and GE. Cheers.
Top Med Talk. Thanks for downloading Top Med Talk. Don't forget to subscribe, check us out on YouTube, and of course on social media. We're on Instagram, Facebook, and X. Also, it's important to remember that Top Med Talk is the broadcasting arm of EPOM, Evidence-Based Perioperative Medicine. We'd love you to find out more about that. And the way to do that is edpom.org. Check out our website and find out about some of the incredible conferences we're going to be arranging across the year. edpom.org.